we needed to do two things. We needed to get inflation down, because you'll never get people will never be able to acclimate to the higher price level unless inflation comes back down to around 2%. And that was behind our work. Getting inflation back down to target was very much an important part of agenda. But that just means prices are rising more slowly. It doesn't mean they're falling. And in fact, to have a broad decline in the price level, you would need a deep recession that nobody wants. So what you need to happen is for incomes to catch up. Now, those dynamics were happening. They were occurring. And I've spoken about this from the podium before. I theorized, probably a couple of years ago, and one of my colleagues and I are trying to write an academic paper about this. I theorized a couple of years ago that if inflation came down and people had enough time to acclimate to the new price level, an acclimation that would be very much aided, and in fact was essentially, it had to be aided by rising real wages or incomes, eventually they'd start to get acclimated and to feel better. Inflation is back down, the price level remains too high from the perspective of consumers and voters, and that's partly, a big part of the answer to your question. I sense you want to say something else.
This long memory that people have on price levels. I mean, do you feel like the president's economic team, the president himself, could have done anything differently over the last few years to better address that, better, sort of meet people where they are? I mean, you've known that is where people's heads have been at for a while.
The question of could you have done something different and better, I always feel like, sure, you could always, nobody's perfect, and you can always improve on what you did. But on the issues I'm talking to you about, we were one of the first folks to be talking about this, to be understanding the difference between inflation and price levels from people's perspective. I mean, I don't know if you remember, but I brought this to our senior staff one day. I brought this, I think it might have been the only time I did this. I brought a handout to our senior staff and said, let me talk to you about the difference between inflation and the price level and how people feel about that. And, economics doesn't think that much about the price level. It thinks a lot about inflation, and not at all a critique of the mandate of the Fed. That's the congressional mandate and the one they follow. But it's full employment and stable inflation. So, and you'll hear Chair Powell talk about that. That I recognize the price level is a stress to people, but my job is to get inflation down. So it's something we've been on for a long time. And it's behind the cost-cutting work that we tried to do here. We cut costs in healthcare. The president talked today about junk fees. You saw the energy results from the SPRO release and so on. We tried to get a lot more competition going in the grocery sector, where there's definitely not enough competition, leading to pretty high markups and profit levels that we've talked about and used the bully pulpit to convey our concern about. But, we live in a capitalist economy, and so prices are generally determined by private markets. But where we could, and healthcare is a great example, because the government is in 9% of the healthcare market. So healthcare is about 18% of GDP, about half of that is the government.